Concerned that pregnant women eat enough fish to provide DHA, but still protect developing brains, the U.S. Food and Drug Administration and the U.S. Environmental Protection Agency issued a joint fish consumption advisory in 2004 for commercial fish.
Our advisory is specifically addressed to women who are pregnant and to children. The focus of our advisory was on the consumption of fish, but primarily on 4 species of fish we were concerned about, and that is shark, swordfish, tilefish, and king mackerel. And on the basis of our assessment, we concluded that pregnant women should not eat these species. As a matter of prudence, we also recommended that children not eat these species. And then we gave some further advice about the fact that fish is an important part of the diet, that there are benefits associated with eating fish, and that for women who are pregnant, we recommended the inclusion of about 12 ounces of fish on a weekly basis.
Fish. What to eat and how much has left everyone with more questions than answers.
The average fish consumer who's buying fish in the grocery store just wants to know what's safe. When we conducted these focus groups with pregnant women, they follow the cautionary principle often. If there's any risk, I'd rather be safe than sorry. But not recognizing, because no one had told them, that there was risk to eating no fish as well. One of the biggest studies was the study in a population of mothers and children in the UK called the ALSPAC study, in which they looked at maternal fish consumption during pregnancy and child development through the school years.
And the ALSPAC study had data on 14,500 pregnancies and the amounts of seafood intake that the mothers ate during pregnancy. So we decided to evaluate the data to test the letter of the 2004 EPA and FDA advisory. Now that advisory advises women to eat no more than 12 ounces of seafood per week. So we divided the group of women at ALSPAC into those that ate no seafood, those that ate some seafood but didn't cross the limit, and those who ate more than 12 ounces per week. And we asked which of those 3 groups had children that did the best. Does a diet deficient in seafood during pregnancy in the mom have long-term results of harm for the children when they were 8 years of age?
And they found that on several of the outcomes they tested, including components of IQ and school performance, that the kids of mothers who ate more than 2 weekly fish servings, which is the limit currently recommended by the federal government, those kids had better developmental outcomes in the school years.
Now we also found that children had greater social problems and peer problems when their mothers did not eat sufficient seafood. That is, they followed the advisory. And the children also had problems with fine motor control and other indicators of neural development. So the reviewers and the editors of The Lancet, when we published the paper, made us add the words that following the seafood advisory was detrimental.